Hi guys, welcome back to Nursing Guru. Are you a second year post basic BSc nursing and who is preparing for your exam? Then this video is for you all. Okay, try to see or watch the complete video without skipping so that you will know what you have to prepare and how you have to prepare for the exams that will be released from the university, that is Rajiv Gandhi University of Health Sciences, Karnataka. Okay, before that we are going to discuss the syllabus, the question paper pattern and the important questions that are covered. Today we are going to talk about the community health nursing, which is one of the subject in second year post basic BSc nursing. Come, let's move to the video. What is community health nursing? Because you have to know the question paper first before moving to the syllabus or the important questions. You have to know how you will be managing the time and what are the questions that will be coming in the exam, and how much marks that you need to score in the exam, or what is the total amount or total marks that will be in your exam. Okay, these are the things that we are going to discuss in this video along with the syllabus and also with important questions. Okay, we all know that the time duration will be the 3 hours. So the community health nursing paper will be having a time duration of 3 hours along with the total marks of 75 marks. To score this entire 75 marks, there will be time duration of 3 marks, that where the question paper is divided in 3 different headings or question paper, like questions, long essay, short essays and short answers. Okay, in long essays there will be 3 long essays in that you need to attend any 2. Okay, in that 3 you need to attend any 2. So each question that in long essays carries 10 marks. 2 into 10 is equal to 20 marks. And now next we'll move to the short essays. In the short essays, again there will be 9 questions. In that 9 questions, you need to attend any 7. Okay, any 7 you need to attend. Remaining 2 will be like an option for you. You can vice versa, you can attend any question which you are more confident with. And in that 7 questions, 7 into 5, each question carries 5 marks, that is 7 into 5 is equal to 35 marks. And next is short answers. In these short answers, that is in community health nursing, there will be 10 short answers, each question carries 2 marks. Here in the short answers, you need to be more specific. Don't elaborate or don't draw any diagram in short essays, because it is all about 2 marks. Okay. So we have discussed the long essays, how much it carries, how many questions are there, as well as the short essays and short answers. So we all know the division of questions according to their marks. Now let's see how you need to present your paper, especially in the community health nursing. Okay. So let's take the long essays. In long essays, you need to write around 2.5 to 3 pages. Okay, we are talking about the pages, not the sides. Okay, 2.5 to 3 pages you need to write, or you need to elaborate the question in such a way that the examiner will understand, the one who corrects the paper will understand what you have written, the concept, okay, the process. So in such a way that you need to elaborate around like 2.5 to 3 pages. Okay, try to depict these schematic representations or any flow charts, because as I said earlier, 2 important things is must and should that you need to remember before starting the exam. What is that? One is your answers should be more specific to the questions asked, and the number 2 is draw a neat labeled diagram. Okay, in this community health nursing there will not be any diagram, but still you need to draw some schematic representations or any flow charts so that it will be additive for your scorings. Okay, that will give your paper as attractive. Follow the schematic or follow any flow charts, anything that you are most comfortable with, but depict in an attractive way or illustrate in an attractive way. Okay, and let's come to the short essays. Here again, let's talk about the pages. Okay, how much you need to write and what the concept you need to write in the short essays. Here again, you need to write like 2 pages, 1.5 to 2 pages. Okay, all about the pages, we are not talking about the sides. And if it is less or more, don't think about the pages. It's all depends on the concept what you are writing and how you are framing your answers and how you are presenting your answers in the exam paper. Okay, and finally is your short answers. As I said earlier, there you should be more specific instead of writing some other related here. In other two, that is long essay and short essays, you can write anything which is related according to it. Okay, here you should be more specific because it is a specific short answers where they will give only for specific answers the marks will be given, or the marks will be added for that. Clear? This is all about the question pattern. We have seen how the question pattern or question has been distributed along with the weightage of marks, time duration and total marks, and two things that you need to remember before starting the exam. Okay, we all know about the question paper or pattern of community health nursing. Now let's move to the syllabus, because you know everything now. Now you want to start to study, or you should be more confident to study the syllabus. So that you are going to write in the exam paper, right? Now let's see the question syllabus, or the questions that will come from the syllabus as well as the important questions. Actually, in community health nursing, the syllabus is divided into 7 units. There are totally 7 units in second year post basic BSc nursing syllabus. Okay, let's see what syllabus had been covered in each unit. Let's discuss one by one, starting from unit number 1. So there are 7 units. Let's discuss one by one, starting from unit number 1. Unit number 1 talks all about the introduction to community health nursing. Okay, it talks all about the community health nursing, the introduction to community health, and also it talks or discusses about the elements, concept, as well as the principles of primary health care, and also the introduction of community health nursing and implications of community in nursing. Okay, so these are the important subtopics of the syllabus that are covered in the unit number 1, along with some important factors or the objectives, scope, principles. Okay, these are some of the topics or some important topics that are covered as a syllabus in unit number 1. And now next, let's move to the unit number 2. So unit number 2 is all about the family health services. Here in this unit, the syllabus that are covered or the important questions that you can study so that you can score good enough marks in the final exams are: one is the objectives, the concept, okay, the scope and the principles of the family health services, as well as individual, family and community as a unit of service. And the next important topic is the working with families in relation to the psychiatric illness or community illnesses, that is communicable and non-communicable. Okay, so in relation to prevention of diseases as well as the promotion of health. Okay, these are some of the important topics that are covered in unit number 2, along with the surveillance monitoring. Surveillance monitoring is also one of the important topic that are covered in unit number 2. Okay, and main important question that comes from the unit number 2, which I am stressing it, is the principles and techniques of home visiting. We all know home visiting is a practical question in community health nursing, as well as it is more important in theoretical as well. So the bag technique, the principles, and what are the elements, what are the characteristics of bag techniques. So read a complete information or a concept of bag technique as well as the home visits. Clear? This is all about your unit number 2, that is family health services. Now let's move to the unit number 3. So unit number 3 is all about the organization and administration of health services in India. Okay, in this unit we will be discussing some of the important topics or the syllabus that are covered under this unit. The first is the national health policies, okay, centrally sponsored health schemes, health team concept, okay, healthcare delivery systems in India, and next central, state, district as well as the urban health services and also the rural health services. So these are some of the important topics that are covered in this unit, as well as let's say some more important questions that may come from this unit, that is unit number 3. Okay, those are the role of voluntary health organizations, okay, and also international health agencies, the role of a nurse in organization and administration of healthcare services in India, as well as the systems of medicines and public legislations. Okay, these are some of the important topics or syllabus that are covered in unit number 3, that is organization and administration of health services in India. And next, let's move to the unit number 4. Unit number 4 is all about the health education. We all know that health education plays an important or a vital role in our nursing when that we are going to give health education to each and every patient as a part of a nursing care, right? So you should know about the concept, the definition, the scope, objectives, as well as the principles and techniques of health education, which will be either for your 10 marks or either for your 5 marks, as well as along with that it may come for 2 marks as well. The definition or the sum of the techniques or scope of health education, whatever it may be. Okay, complete details of health education, you should be more concentrate on it. Okay, along with that you should give some importance on the communication techniques, the methods and medias for health education, and national plan for health education, and planning for health education and its and the role of nurse. Okay, these are some of the important topics that are covered in unit number 4, that is health education. Now let's see unit number 5, that is the role of the community health nurse. In this unit there are important subtopics, so that we are going to discuss further. Let's start with the important thing, that is the national health programs. Okay, try to study all national health programs that are covered in this unit. And next is some of the rural health services, that is family welfare and school health services. School health services is also an important topic where you will get at least one question either from 5 marks or even for 2 marks as defined. Okay, so the one is national health programs, and second is family welfare and school health services. Okay, and rural health programs and mini programs, either urban or rural and NRHM, national health programs. So all these are covered in this unit. Okay, so the school health services also you need to study in detail, as well as the family welfare services, occupational health services. Okay, as a member of health team, this will be like a concept you need to understand and to write in your exam. Okay, so these are some of the important topics that are covered in unit number 5, that is role of the community health nurse. Okay, next let's see the unit number 6. Unit number 6 is all about the epidemiology. What is epidemiology? The definition you need to know, the concept you need to know, the scope, objectives, principles, the methods, and also the theories and models of epidemiology is also very important. That suits for either 10 marks or even for 5 marks as well, and sometimes short answers for defining. Okay, these are some of the important questions, as well as the grounded level question is applications of epidemiology in community health. Applications of epidemiology in community health is also an important question that suits for the short essays. So this is all about the unit number 6 that comes in the community health nursing for second year post basic BSc nursing. Now let's discuss unit number 7, which is the last unit in community health nursing, that is for second year post basic BSc nursing. Okay, so in this unit, the last unit is the biostatistics and vital statistics. It's all about the statistics. Okay, here you have to give more importance on the introduction, definition, scope, and the values, as well as the principles and methods of calculating, or the techniques of calculating or computing the vital statistics, as well as the legislation, reporting, and recording and compiling of vital statistics at the state, at the local, as well as the national and international level. Okay, so you should give more importance on the local, state, and that is central or national, as well as the international level of recording and compiling the vital statistics. And also you should give some importance on the definition and also the methods of computing vital statistics. Means like there will be some of the formulas that will be coming under the statistics, that is for calculating. Okay, computing vital statistics. Okay, these are some of the important topics or syllabus that are covered in the last unit, that is biostatistics as well as the vital statistics. Okay, this is all about your syllabus or some of the important topics that, as I mentioned, along with the weightage of the marks, either it may come in the long essays or in the short essays as well as in the short answers, right? Okay, this is all about your community health nursing. And we have discussed the question paper as well as the syllabus and questions, important questions that might come in your exam, and how to manage and what are the tips that you can follow. So everything we have discussed till now. So far, if you have any doubts, do comment in the comment box, or if you have any further clarifications, just come up with the doubts. We'll discuss in the upcoming videos. Thank you.